Joining us now to review some of the headlines of today's newspapers from around the world is Arise News analyst Emanuel Efeni. Good morning, Emanuel.
Good morning, Ruben.
Good morning.
Good morning, Tundu. How was the weekend?
Fantastic.
Great.
Efeni, be careful. Rufai is here.
Rufai, you are welcome.
Thank you, sir, but I take strong exceptions to excessive platitudes to Tundu.
Well,
Strong exceptions, Mr. Efeni. Or else we will become Oshomole and Obaseki this morning.
we are not going to fight over Tundu. Let's just move on with the newspaper review. This day, we'll start with this day newspapers as usual. The lead story, with 38 new COVID-19 cases, Lagos records first slump in 3 months. 260 fresh incidences, raised total to 12,486, with 3,959 discharged, 354 dead. Nigeria imports COVID-19 drugs from Bangladesh. Yes, for the first time in recent months, the number of cases in Lagos declined, and that it declined significantly with only 38. Of course, recall that the highest number of cases in a day occurred on May 30 with 378 out of 553 confirmed cases nationwide. Can we say that Lagos is declining? Not exactly, maybe declining, maybe. But we need to see a consistent drop to celebrate this number. But in the next couple of days, we'll know whether Lagos is actually declining in terms of confirmed cases, or this is just a one-off for the time being. So, good news perhaps, but we still need to wait a while to know whether there's actually a decline in Lagos, which has been the epicenter of the COVID-19 infections in Nigeria. Ruben, Tundu, and Rufai.
Well, I think one, as part of latest developments, we've been told that the governor of Abia State has also tested positive, and he has gone into isolation, and he has asked his deputy governor to take over. And of course, that should interest many Nigerians, because you'll recall that that same governor in March had said that Abia State is the only state in Nigeria that is recognized by the Holy Book, the Bible. Okay. And because of that, there will be no case of COVID-19. Okay. But now we have this development. We wish him well, quick recovery. We wish him quick recovery. Yes. Now, as for the situation in Nigeria and in Lagos, I think it may be too early for us to begin to jubilate that maybe in Lagos the numbers are, are reducing. Let's wait till the various places of religious worship, the churches, the mosques, reopen, because there may be some frightening dimension to that. From what we saw yesterday, I think in the Federal Capital Territory and some other parts of the country, people just trooped out to the churches and they didn't quite follow the guidelines. So the major challenge will be one of enforcement. And then, of course, you mentioned about medical supplies. Well, we shouldn't be getting the medical supplies on an episodic basis. If you look at the United Kingdom, they are planning ahead, even beyond COVID-19, to make sure that they don't run into a crisis. It looks like in this case, we had to quickly order for remdesivir and Remiv because we were running out of medical supplies and protective personal equipment.
Well, this was just a part of the planning process. They're only announcing the arrival of these drugs, because it wasn't as if they were ordered yesterday and they will be here tomorrow. They must have been planning for that. Let's hope that also there are plans down the line to bring in more supplies without so much fanfare, if you will, Ruben.
Okay, Mr. Efeni, I would like to talk to you about the phase we are getting into now, that we are running out of beds, and the modality for home care is something I'd like to hear Hanere speak more about. That's the Minister of Health.
Yes.
What will be the modality from home care? How are you going to isolate in the home and take care of yourself and not spread the virus to other family members? Are they going to have to teach other family members about it? How are they going to do it? In the country where most of us live in what we call shotguns, face me, I face you, what is going to be the modality around that? Because we're already getting to a point where the beds are getting depleted.
Well, just before Tundu comes in, let's look at the Punch newspaper perhaps to get some answers to that question. The lead story, crisis looms as COVID-19 cases outnumber bed spaces in states. Nigeria with 6,994 bed spaces as of Friday, battling with 8,065 active cases. Patients with diabetes, hypertension, others ruled out of home care. But if you read this story, because it sounds very alarming, a paragraph I just take from that story. However, the Federal Ministry of Health, in response to Punch's inquiry on Friday, said only few states, such as Lagos and Kano, were battling with a shortage of bed spaces. So, headline not necessarily corresponding with the content, because the headline sounds very alarmist, but they are saying only Lagos and Kano seem to have that problem right now. But as for the home care for those who may be so directed as a result of shortage of bed spaces, well, I'm sure they'll work out the protocol so that we don't compound the problem of this pandemic, COVID-19 pandemic in our country by asking people to self-isolate at home when they test positive.
Yes, it could indeed be a disaster. We're having a guest later on. We'll discuss it with her. But I remember reading reports coming out of Mumbai that they've run out of beds and COVID-19 patients were sharing beds, which is appalling, and that then the morgues ran out of space, so they had the deceased wrapped up in plastic bags and placed in wards with patients. I mean, what does that do to your morale, to your psyche while you're trying to battle a deadly virus? Which is why in Italy, some success was recorded by people who were treated at home, even the elderly who were discovered perhaps not in that much need of clinical intervention were treated at home. And those people recovered well. And it was posited that because they were around their own home comforts, that they were able to recover. That when you're in a hospital and it's in cramped conditions, it's not the most amenable environment.
Well, it's doable, but we have to be very sure of what we are doing in order not to create more problems.
Yes.
Yeah.
In fact, the official position of the Nigerian Medical Association, speaking through Professor Uja, the new president, is that, look, if you adopt this home care strategy, you could escalate the situation. And his own recommendation is that, why don't we look in the direction of getting hotels, creating more bed spaces, instead of saying that it is not possible. But as you pointed out, only 3 states seem to be really affected. Most of the other state governments, including Gombe, Ogun, Oyo, and a host of others, about 8 of them, have said that they don't want to do home care because of the logistics involved.
Okay, let's move on to other subjects. Concerning the impact of the COVID-19 pandemic, the Daily Trust newspaper, job cuts displace workers as COVID-19 hits employers. Now, if you look at the areas actually affected, worst hit industries, small and medium-scale enterprises, aviation, media, Ruben, media, and hospitality, yes, it's coming home to roost. Now, if you look at the areas they're talking about, 42% of workers have lost their jobs, according to figures released by the Nigerian Bureau of Statistics. And of course, there is also the diminishing income of households. 72% of households have experienced diminishing income since this pandemic hit our shores, and it's not looking good, the impact.
Well, I mean, that's the way it is all over the world. It's not just in Nigeria. Even in the United States, where they're celebrating a drop in the unemployment figures, at a point, that figure was over 14%.
In fact, over 7 million claims, unemployment claims.
Yes, but anyway, thank you very much, Emanuel Efeni.